So just a few months ago, Lenvatinib was FDA approved for the treatment of radioactive iodine refractory progressive differentiated thyroid cancer. And the large phase 3 study was reported here at ASCO last year, which showed a significant improvement in progression-free survival. And interestingly, also both in the first line as well as in the second line setting. So it was a very active agent. One of the things we were interested in as investigators on the trial, one of the pre-planned analyses was to actually look at patients stratified by age, looking at them whether they were younger than or older than 65 to see how they did. And so this analysis was performed, and the first thing we initially looked at was to see whether or not it was tolerated well, because there's always an interesting bias, it seems, in a lot of the people who are treating thyroid cancer, that they actually withhold the therapies in the older patients out of concern for toxicity and how well they'll manage it. So this was a very important, I think, question to ask. And when we were doing this analysis, what was interesting is we also looked, of course, at the primary endpoints, including progression-free survival and overall survival. And when we actually looked at progression-free survival, it looked like there wasn't a big difference between progression-free survival necessarily between the older and the younger patients. But interestingly, the overall survival, which has not been, the primary endpoint has not been met for the study overall, but what's interesting is that in the over 65 population, we noticed something very interesting, which is that the overall survival for over 65 was significantly worse than the under 65. So overall survival, and that wasn't a surprise. We knew that patients with aggressive disease, when they're older, they just don't tolerate it very well. But what was really a surprise and very welcome one was that we discovered that Lenvatinib completely abrogated this effect. So the treatment of using Lenvatinib in this patient population, we were actually able to improve the overall survival in the over 65 population. So again, I caution that this is not the primary overall survival endpoint, but basically it was a pre-planned analysis of the patients over 65 who basically had a statistically significant improvement in their overall survival. So the meaning for this, of course, is it's clear that obviously, number one, we should not be withholding treatment from our older patients. Number two, I think it's one of the first times that I'm aware of that actually a kinase inhibitor therapy, even one that had crossover in its design, showed an overall survival benefit for any population. So clearly we have an active agent. It actually says that it might suggest that patients in over 65 should be getting treated with this up front, because now we have an overall survival benefit associated with it. So it's actually very important, and as I said, another sort of first, because I don't think we've seen overall survival in solid tumors from the kinase inhibitors. So another first for thyroid cancer.